Truth wears no mask, seeks neither place nor applause, bows to no human shrine. She only asks a hearing. A very pleasant good day to you wherever you may be, and welcome to the University of Common Sense. My name is Tim Morrow, and for the next few minutes, I want to take you on a journey, sometimes even a nightmare. But I want to take you on this journey. I want you to go on this journey with me because the University of Common Sense, we are about not education. We've already been miseducated. We're about information. And so that's what we want to bring you today. In the studios today, I have a guest with me, and she is rather special. I haven't known her that long. But she does something that I talked not very long ago. We talked about the dialysis machine. Well, here's a lady that knows a lot about the dialysis machine. And I want this to be heard from more than me. People sometimes think I'm a little left wing or a little right wing, but I want you to know from people that it happened with. Keisha is one of those people that came to my audience, and we talked at length because she is an assistant. Well, I'm going to let her introduce herself. So welcome with me, Keisha Estevan. Welcome. I thank you so much for taking your time out, driving over here to do this with me. Would you tell me what it was that you did at the dialysis center?
I was a dialysis assistant.
A dialysis assistant, which means you were what?
I was assisting the dialysis techs, but that's not, my job was to be the receptionist. And then somehow I ended up working on the floor and doing reuse. Reuse is where they sterilize the artificial kidneys that they use on the patients.
They sterilize what?
They sterilize them so that the patients can reuse them again.
Okay.
So they use them over and over again. They're called artificial kidneys. They hook them up to the machines so that the blood flows through. It's like a fiber type of thing. And the blood flows through there to supposedly clean it out, and then it goes up through the top, back through the machine, and it comes back goes back into the patient. So it's like a recycling system.
Okay, so then this is like some little bladder type thing that
it's like
plastic.
It's plastic on the outer part, and it's like a fiber material on the inside. So I used to sterilize, like clean them, open them up, clean them, and put them onto a machine, and it would be sterilized with, it's this stuff called Renalin.
Renalin?
Yeah, Renalin, and they use that to sterilize the kidneys, the artificial kidneys, so that they would be ready for the patients the next time they came.
Okay, so in other words, you're saying they use them over and over and over again.
As long as the machine says it's okay to use it again. Because when I put it on the machine to have it sterilized, the machine tells you if it's okay to use again or not. And most of the time, yes, and then sometimes no. It wouldn't pass, so we would just get a new one and start all over again.
What would you do with the old one?
Throw it away.
In other words, it was disposed of.
Yes.
Huh. Already you told me something that I didn't know about. As much as I know about dialysis, I know about the people that are on the machines.
Yeah.
But the operation itself I know very little bit about. But that's the reason why I wanted to talk with you.
That's how I started they started me back there, and it's called reuse, in the reuse room. And that's where all the chemicals and all that stuff they use in the machines. And actually it's going into the blood system of the patients. And they said it's okay. I mean, it smells really bad. and I was pregnant when I was working there, so of course I asked questions, and they said that it was okay, to inhale that stuff.
Oh, really?
Mm-hmm. Yeah.
And this was the thing that you said smelled really bad.
Yes.
And the name of it is what?
Renalin.
Renalin.
Yes.
Okay.
Mm-hmm.
Tell me a little bit about how the patient is hooked up to the machine.
Oh. Okay. They have a graft. When they're in the hospital, the doctor determines, or their blood test determines whether they need dialysis or not. So they go through surgery, and a graft is placed underneath the skin.
So is that
it's like a tube. It's shaped like this, like a U shape, and they place it underneath the skin, and so when you put the needle in, it hits that main artery, the venous and the arterial.
So it means that's the same thing they call a shunt?
Yes.
Okay.
Yes, it's also called a graft, so that the needles fit in there perfectly. But of course, it's painful every time the patient goes through that. Sometimes they get a shot to deaden the area before they stick the needle in, because the needles are so big. And then sometimes it doesn't go in. Or sometimes it'll go in and they'll have a blood clot, which I would have to take them to the hospital, and then they would have to go through surgery again. Every time they get a blood clot, they have to have surgery. The doctors have to reopen it. They have to reopen and to find where the blood clot is, to release the blood clot. Then they sew them back up, stitches, and then they go back and go through the same thing again.
Well, apparently this thing must wear out. They can't stick it in the same place.
Well, if it wears out, then they have to put one another in somewhere else, either in the other arm or the leg. And sometimes they put a temporary one right up here. Some people use it in the leg. A lot of people that work, they have a shunt in their leg.
Well, the shunt, what the graft?
Yes.
Graft, you call it? That being in there, if they're not able to plug in, what happens? Do they miss the treatment for that day?
I would take them to the hospital, and they would do it in the hospital, either through they put a temporary tube here, and they go through the surgery and to have it, the blood clot released, so that they can be back to have their next treatment at the clinic.
They can't just put it in the skin itself? They have to have this graft?
Yes, they do.
Do
Because
you know
it has
why?
to go. No, I don't know why. I don't really think anybody needs to go through that, to be honest with you. I don't. And they just really rush them in just to make their money. I don't really think anybody needs to have dialysis. I think it's very humane. It's disgusting to me what they do.
Well.
Because it's not working. What are they doing? I don't understand. That's why I quit.
What amazes me is that everybody has to go 3 times a week.
Mm-hmm.
I don't quite understand that. Any particular reason for that? Because my reasoning is that they're not justifying the patient, they're justifying the machine. And as long as the machine is busy, it's making money.
You're right. You're right. And they have to go. But they tell the patients that they need to go 3 times a week because the body fluid that they contain, there's a limit on what they drink, their fluids, on what they eat. So the patient's thinking that they're gaining too much fluid and they have to go into dialysis to take the fluid off. So
wow. Can you tell me at all if there's any deaths,
All the time. all the time, all the time. And they all die of the same thing. Aneurysm, it's either, mostly it's in the head. I've never seen a patient make it through that. Or heart failure. They end up getting a leg cut off, or first they start off with a toe or a finger, and then it's a foot, and they all end up dying, and they all sit around and they all wait to see who's going to be next.
Really?
Mm-hmm. I had a patient once tell me, he told me that he felt like Frankenstein with all these tubes, and he's like, there's got to be an easier way, and he didn't want to come back.
Wow. Does anybody ever just plain old refuse to come back?
Mm-hmm. My father was one. He didn't want to go. He said that they were going to kill him if he went back, and I made him go back because I thought that was the right thing to do. I thought that dialysis would sustain his life, and he would be fine. And he would go. He would take the phone off the hook. He wouldn't answer the door because he said that he did not want to go back there, that they were killing him. And he would try to tell the doctors that the machine would be turned up too high. He couldn't breathe. He passed out a couple of times on the floor, and they told him to get up, that he would be fine. And he refused to go, and I talked him into it. And they ended up killing him. He died.
We're speaking with Keisha Estevan. She's an assistant, well, she used to be an assistant to the dialysis, whoever it was that put you on the dialysis machine. But she tells about the nightmare that I've always known that goes on there. And the reason why I'm bringing her to you is because I want you to know this from more than me. This is somebody that is there, that works in it, and that knows all about it. It's a nightmare I don't want to see. It's one of those things I don't want to see. I got a very weak stomach, but I do want to hear about it, and I do want people to know that I'm not telling untruths here. I'm telling what actually goes on, because I have a couple of friends of mine that died on the machine taking a treatment. And here we're listening to this very same thing happen here. Miss Estevan, without becoming grotesque here, what's the worst thing that you see happen there?
Well, there's a couple of things. There was an old lady. She must have been late, like 89. She was blind and deaf, and she couldn't talk. She couldn't write. She was in a wheelchair, and they wanted to put her on dialysis. And you have to sign a consent. You have to, before they can start you on any treatments. And they were trying to get her to write her name on the paper, but she couldn't, so they wanted me to hold her hand to write her name on there so that she can dialyze. But I wouldn't do it. And they found a way to do it, so she ended up on the dialysis. But she didn't last that long. She would try to pull the cords out. She cried the whole time she was there. She just kind of like whined, and you could tell that she was in a lot of pain. And we had a couple of other patients like that too. They were so old, but they couldn't talk. Some of them couldn't speak English. Those are the ones that really got to me, were the older ones that couldn't defend themselves and couldn't speak up for themselves. And there was this one man that we couldn't get a pulse on him. There was no pulse, and they still wanted to hook him up to the machine, like really fast. I guess before he died.
Well, if there was no pulse, he was already dead.
Mm-hmm.
And they
So
still
that
wanted to
was-
hook him up to the machine?
Mm-hmm. Yeah, they needed to get that treatment in for the day, even if it was just the needles being put in. He was on the machine.
They would be paid for it.
Mm-hmm. Exactly. Exactly. And I think that's what really got to me were the older people. I mean, there were ones they had to give extra amount of drugs to so that they wouldn't be able to pull their needles out.
Oh, really?
Mm-hmm. They had to like...
So in other words, they had to drug them out of their mind so they couldn't...
Mm-hmm. Yes. So a lot of them came drugged, already drugged and half out of it. But I can tell you one thing. When I would sit there with those patients, I would talk to them. And I would say something like, squeeze my hand if you want to be here. Or squeeze my hand if you're in pain. And this one lady, she was blind too. She only had one leg left. And she didn't speak English. But she would squeeze my hand. And I would sit there and talk to them and try to keep their minds off of what they were going through.
Keisha, there has got to be somebody there with some compassion.
No. They told me not to be there. I couldn't handle it. I shouldn't be there. You just get used to it, they said. Day after day, you get used to it. I didn't meet anybody.
What incident was it that caused you to quit, that make you knew you could no longer handle it? Or if there was an incident, or was it a bunch of incidents?
It was a bunch. But that one man with the no pulse, that really just did it. And I told him I couldn't stay. So I told him I didn't want to be on the floor anymore, and that I was giving my notice. And I would work there until the end of the month. And I had to leave. Because it was just a pattern. And the patients are coming there thinking that they're going to be okay. They're taking tons of blood from them every week. And I'm sitting here cleaning these artificial kidneys out, and nobody got better. Everybody got worse. You know?
You were there how long?
2 years.
You never saw anybody get better in 2 years?
No. Mm-mm.
In 2 years, nobody left. Do you ever get off of the dialysis machine?
No.
So you're there for the duration.
Mm-hmm. To sustain life. But what do a blind person with no legs have to look forward to? Why are they going to dialyze a lady that can't see with no legs and no family? You know? And then they do surgery on these old people. They did open heart surgery on a lady that was 80 years old. And she didn't make it out of the surgery. But they got paid. You know, her family's suffering. And there was another lady that I talked to all the time. She was fine, and they did. Oh, she was going to be 90. She didn't have any family either, and they did eye surgery on her. Eye surgery, so she could see.
Did she see?
She could already see. She couldn't see after the surgery, but after that, she died.
Why was she on the dialysis machine?
They said her kidneys weren't functioning. But all of the patients, sometimes we even have to stop them. We have to take them off the machine so that they could go to the bathroom.
What?
Mm-hmm. Or we'd get a bedpan if they couldn't be taken off the machine. They would put clamps and let them go to the bathroom because they couldn't hold it.
You mean they put clamps on the...
Mm-hmm. Because the tubes they use, they can be, you know, taken out and put back in. So they would clamp it up to stop the blood flow so they could go to the bathroom.
So the person's blood goes through this artificial...
Yeah.
It's filtered, How is it put back into the system?
It goes in a circle. It comes out one tube, goes through the kidney into the machine where the machine is supposed to clean it, like wash it up and clean it. Then it goes back out the other tube and back into your arm. So you have your venous and your arterial, you know, the tube. One goes in, one comes out, in and out. So it's going back in, and it's supposed to be clean when it goes back in. The blood, they're supposed to be cleaning it out. I don't think that's what they're doing, but that's just me. That's what they tell the patients they're doing. And everybody gets up and they're weak. They end up being really, really super skinny. And they have to watch how much water they drink. 3 cups or something like that.
Yeah, one of the things that happen is they tell people that your one kidney is 85% blocked and the other one is maybe 70% blocked, and before long you won't be able to urinate anymore.
No.
And that you need to go on the dialysis machine. When they put them on the dialysis machine, they restrict their intake of water. Now the person, after 3 or 4 weeks, are no longer urinating, and they're saying to themselves, the doctor said that I wouldn't urinate after a while. But the reason why they're not urinating is because they're not drinking any water.
Exactly.
And the little water that they are taking in, the body is holding it because it can't afford for a second to let go of it. And so the person is duped, literally duped into the dialysis. You said something that was rather interesting to me when I first talked to you. You said something about the doctors and the dialysis center.
Oh, how they all own them? They all own the dialysis center. We had a husband and a wife. Most of the patients are theirs. And they, this year, as a matter of fact, they took it over from the company that had it. It was Clinisher Dialysis, and the doctors got together and they bought it. So now the doctors own it.
The doctors own the dialysis center now. Okay, you said this is a man and his wife, are they doctors?
Yes, they're both doctors.
They're both doctors. And they bought it?
Yes.
They bought the dialysis center?
Yes. More than one.
Oh.
There's a chain of them.
Oh, really? So in other words, the doctors feed the centers. And since we are such trusting people and we believe what the doctor says, they tell us that you need a dialysis machine, and everybody just falls for it.
And the families too.
What role does the families play in this? Can the family make them go on the dialysis machine?
Well, if the patient is strong enough and have a strong will and sticks to no, then they have to do it. I mean, they can't dialyze them if the patient is saying no. But the family comes in. That's where the doctor gets the family. Your father or your mother is going to die if don't dialyze, and you've got to get him in here right now. He's got to come in now, even if it's just for an hour, even if it's just a half an hour. You got to get him in here. He has to dialyze. So the family, of course, you know, they talk the person into going.
That means it's got to be very lucrative. It's got to be a very lucrative. If it's important enough to them to get the family involved, to get them on that machine, that's got to be a lucrative, very lucrative deal.
They get really upset if you miss. Really upset. Very upset.
If you miss, that means that the machine had to go off. And you were not, and when that machine goes off, they're not making any money.
Because you have to keep a log of everything. And I used to do that too.
You used to keep the log of everything that goes on there.
And the billing and everything. So I knew. And then that's when I started thinking, you know, putting two and two together.
Doesn't anybody else there put two and two together? Or is it just a job?
But they know. That's the thing that really got to me, is because they know, but it's their job. It's just a job to them. That's what they do. It's their job.
Ladies and gentlemen, we've brought you this nightmare via the fact that somebody has been there and saw that and did that. We didn't bring this here because we thought it was entertaining. In fact, we thought quite the opposite. But it's one of the things that I've been talking about forever. It is now a very lucrative field, a very lucrative field. You can understand about what she said, that some of these people are amputees and some of them, they feed each other because the center is feeding the hospitals as well as the hospital feeding the center. It's you wash my back, you scratch my back, I'll scratch yours. But not one of us has to be a victim. It is now and always has been survival of the fittest. That's the reason why here at the University of Common Sense, we always try and tell you the information that you need. Thank you so much for coming down, taking your time with us, giving us the gory details of what goes on. I appreciate so much your time.
No problem.
And once again, growing old does not make us sick. It is growing sick that makes us old. This is Tim Morrow speaking on behalf of my guests, saying we sure hope you'll see us next time. Thank you for watching.